With the changing demographics and delaying childbearing, we are seeing more and more couples needing donor eggs. And donor eggs compromises close to 20% of all IVF cycles. Partly because of the delayed childbearing, partly because people are more aware of it, and lastly because people are sometimes having second relationships, and those are typically later in life and they would like to have a single child with a new partner. And so we do see more donor eggs than we used to see before. It gives very good outcomes. We can do a lot with good results with donor eggs and help people even in their late reproductive age to have a family. Donor eggs are of two types. One is frozen eggs, one is fresh eggs. Frozen eggs are frozen by the donor, and typically there are frozen egg banks out there who give you lots of eggs. Lot means they make 6 eggs, 8 eggs as a group. You use those eggs to fertilize them with the partner's sperm, make embryos, and then do transfer. A second type is fresh. Fresh is you pick a donor or match the donor to the recipient, and this donor undergoes stimulation with medication like an IVF stimulation protocol. We collect those eggs, which are considered fresh eggs, and they are fertilized with the partner's sperm. The advantage of the fresh eggs is they're better quality because freezing the eggs and then unfreezing does decrease some aspect of function. And other aspect is many of the donor patients would like to have more than one child. When you use frozen eggs, you may start with 6 eggs. It leads to 5 surviving the freeze, 4 eggs fertilizing. So by the time they reach day 5, there is a drop in growth of those cells, and you may have only 1 embryo to transfer, or maybe 2 embryos to transfer if you got a very good luck with it. So you get practically 1 chance to transfer those embryos. And these embryos are not genetically tested because there are very few embryos to start with. And so your chances of success are a little lower. And if you succeed and if you want to have a second child, you have to buy a second lot of eggs. And they are cheaper than the fresh, but they're still not very cheap. So in the end, they become more expensive than fresh eggs. In fresh eggs, you may get all the eggs made by the donor. So there may be 15 eggs, 20 eggs, 25 eggs. You fertilize them so you get better fertilization, and you get better development of those embryos to day 5 or day 6 blast embryos. And you will have the option to test those embryos if you wish, because you have plenty of embryos to work with. You may have 8, 10, 12 embryos to work with. And when you test them, roughly 50 to 60% of those embryos will be healthy. So you know which are healthy embryos. So they have 46 XX or XY chromosome. So you can prevent Down syndrome, trisomy 13, 18, 21, and monosomies and all, and other chromosomes which can lead to miscarriages. And you can also know the gender of the embryos. So if you want an ideal family of 1 boy, 1 girl, you can pick a boy embryo first time and transfer. All embryos are frozen, can come back after 1.5 years when the baby is 9 months old or 1 year old, and have a second embryo transfer, and you can pick a girl embryo and have a balance of family, which most of the couples would like.